Hi, everybody. So, this lecture is regarding community organization, and this aligns with Chapter 5. And I don't want to go too deep into program planning. Again, I could teach an entire course on what it takes to get a community together and help them plan to promote the health of that community. But this is really just a brief overview, 15 minutes to give you an idea of what it takes, some of the important terms, and some of the steps that are necessary and required, okay? So this, again, aligns with Chapter 5 if you are referencing the book. So one of the things that you cannot ignore when you're looking at a community, whether it's a geographic community or it's a group of individuals who have similar interests and all congregate together, is the fact that behavior change is really hard. I'm not sure if you've taken any psychology courses, but if you think back to even an occasion where you wanted to change your own behavior, right? It's not something that you stop doing something and you start doing something else and you never relapse. Okay, so, and that's just one individual. So when you think about changing a community, you have to have a lot of support built in to help people permanently change their behavior, a lot of structure. And in a community, you're thinking about laws, regulations, culture, support of their peers, right? So really at the heart of organizing any type of community for health promotion change and planning, you have to consider what behavior they're changing. So organizing your community. It was actually coined by American social workers, the term community organization, in the late 1880s. And they were trying to coordinate all these services for immigrants who were coming in that desperately needed assistance. So those who were poor and the immigrants who were coming in who needed support, whether it was translation services, housing, food, jobs, they really had to come together and organize the support for these individuals. So American social workers, late 1880s, kind of coined this term community organization. And if you look at this picture, look at all the different social issues that, I mean, this is just an example, but they all exist in some capacity, right? And domestic violence, gangs, police brutality, traffic accidents, social stratification. So thinking about how people are separated in the social world, social inequality, right? Why is there differences in income or opportunity? Gun control, euthanasia, safety and security, all of these things are things that have been discussed, talked about, programs have been created to combat them. So this is just an example, but you can imagine how communities have all these different health problems to approach, and how do they come together and decide how to do this. So there's various methods of interventions to deal with social problems. And when you're program planning, it really is much more of an art than it is a science. So what I mean by that is every community that you approach is going to be completely different. So you can't just pull out your book of step-by-step instructions. It's much more about your ability to adapt, to understand the culture of that community, and to perform the right types of needs assessments and tests to know what is it that they truly want. So technology, I found this interesting because I'm actually referencing the book when I mention this. Technology has had an effect on how communities organize. And I think that, I don't know what your thoughts are on this, but I think that technology has done both good for organizing communities and also bad for organizing communities. So out of the book, they really emphasize that we're more independent. Okay, advancements in technology have made people isolated, more independent, able to reach out to people that maybe are across the country for advice instead of talking to your neighbor that day. Everybody has a handheld digital device, right? You may be on a bus full of people for a year. Every day you take that bus to work and you never once talk to somebody to learn their name. You have cell phones, internet. If you have a plumbing problem, you don't call the local plumber, right? You use the internet, you figure out who's the best. And maybe even if you have a cousin who's a plumber in California and you're in New York, you might call them to get the advice, right? And then increased mobility. So think about the fact that you could book a trip to Europe tomorrow, right? You could travel abroad for a couple months. All these increases in technology are making us not depend on each other as much. Really, we can find all the answers that we need on our own. And I think that's really the perspective that the book is taking. But at the same time, I also consider that we are more connected to people in the digital world than we may have been in the face-to-face world. And that may be a very millennial thing to say coming from me. But I've seen groups of people who are so close knit and they talk all the time on the phone or Skype or FaceTime, and they're part of a community that is online. They may be across the country. I've seen relationships that, they live in different countries, but they're thriving because they're able to utilize technology to keep themselves close knit. So, it may be kind of isolating people and making them a little more independent, but at the same time, it's offering them different ways to connect with people who are more similar to them. So your community and the way that you organize them, when I'm talking about community, sorry, I pause because this is really such an in-depth subject. How do you approach a community and organize them? There are tons of theories. There's tons of different methods. There's tons of different, outlines that you can use and follow for your community. So I just want to go over some of the key terms when you're talking about community organization methods. So planning and policy practice, okay? If you're utilizing this type of method, you're really gathering the data, you're generating rationales, and you're proposing and acting on a solution. So what I think of when I think of this is maybe you're testing soil for certain levels of pollutants, and those levels of pollutants are backing up your rationale or your reasoning for why you need to eliminate a local industrial plant's pollution. Okay, so you might link that to the data of the increase in cancer in the area. You may link that to the data of increase of any type of disease in the area. And then you propose a solution. So you say that there are filters or certain machines that can eliminate that pollutant. And you propose that as a solution, and then you act on the solution. So that's the planning and policy practice. There's also the community capacity development. So you're empowering those impacted by the problem with knowledge and skills to understand and then cooperatively deal with the problem. So if you're thinking of community capacity development, and maybe you have some individuals who live by a lake, and they know that that lake has a severe pollution problem. So what you do with the individuals by the lake, is you teach them safe ways to handle water. You empower them with the knowledge of when the pollution will be at its worst. And then you're kind of dealing with the problem, and you may not be acting on a solution, but you're giving the community the capacity to stay safe and kind of giving them the tools that they need to make sure they're okay. Social advocacy. So this is addressing a problem through application of pressure. So this is when you think of individuals who are upset about a certain issue, right? And they kind of come outside the building and they have signs and they're protesting actively. This is when those citizens of the community are standing up for themselves, and they're making it known that there's a problem and they believe they know who can fix it, or they believe they know who caused it, and they're going to bring it to their attention. So these are all different ways that communities kind of come together. So important terms as far as community organization, and let me move myself. All right, you may have heard of some of these terms. If you really get into public health, I have no doubt the second that you take your first program planning course, these will all come up again. So a grassroots organization. When you have something that's grassroots and you hear public health officials say that it's grassroots, there are certain members from the organization that decided that there was a problem and they initiated the change themselves. For example, I know I worked alongside somebody who knew that it was actually the Tonawanda Coke plant, and if you're familiar with that, it's a really good example. They knew that there was an issue with the pollution. They knew that people around the Coke plant were getting seriously hurt and diseased for life. So they were a grassroots organization that teamed up with a nonprofit, and they really did initiate all the research that was needed. They presented things at the library to the community as a whole to get the community on board. Gatekeepers, if you're going to go into a community or you're part of a community and you want to make a change, you're going to have to understand who are the gatekeepers. So these are those people that have the real political or social power to make a difference and influence others. So it may be formal, it could be a politician, or it may be informal. Maybe it's the leader of an activist group. And they really do help to steer the political climate of a community. People who influence a lot of people at once. Task force, right? So this is a great example of something being grassroots. So if you organize a task force in order to really investigate a problem and deal with that specific problem, it's kind of like this temporary group to see how far you can get. Okay. Once that task force gets to a certain point and you start to bring in people to work with you to deal with the problem, then you have a coalition. Okay. A coalition is a much more formal alliance. It's organizations that come together and they're all working on that common goal to reduce whatever it is that the social problem is. All right. Community building. Okay. So this is a little bit of a different term compared to fixing the problem and just approaching the problem. When you think about community building, there really is a focus on what does this community do well? Okay? What are their assets and how can we build upon them? So for example, if there's an urban community and those who are not participating in the after-school program are maybe having issues with street violence. So those who are kind of leaving the school, having issues with street violence right after school, but they have this after-school community that works so well in a school just down the street. You kind of assess if that school has the capacity to do it, and if it does, if it has the same setup, you can create that program there as well. And you can create all these different programs, and if it's working well, you build upon it. And that's the way that you can approach fixing the problem, as opposed to going out and creating laws and regulations and security. Okay, mapping community capacity kind of goes hand in hand with community building. So you're identifying what assets that community has, not the concerns or the problems. So focus on what they have that could really work for them, and then build upon it. All right. So health promotion planning, in 1979, the U.S. Surgeon General's report on health promotion and disease prevention, which was Healthy People, started to steer away from curing disease and move towards prevention, which is what we all want to hear, right? That seems like more the solution than what we've been doing in the past. And lastly, I just want to define the difference between health education and health promotion. Health education is a part of health promotion. So when you have health education, it's the combination of learning experiences and theories And health promotion is really getting into the regulatory efforts in the